Welcome to the Change Project for the School Health Clinic. Within this introduction, we'll be discussing the resources within this situation room, along with the details of the scenario you've chosen. So it appears you've found the situation room for this problem-based scenario. That's a great start. Keep exploring within the virtual world. You'll never know what you'll find. This situation room was created to house resources to assist you with your change project. Make sure that you access all of these resources, as they will really assist you in understanding the problem and developing a solution. So if you're watching this, then I think I can assume that you found the presentation board within our situation room. You'll notice that the yellow arrows around the room indicate resources that you have the ability to interact with. Again, exploration is necessary to make the most out of this activity. To assist you with the research that may be required to evaluate your problem and find a solution, we have created an extensive list of web resources that will assist you. Explore several of these sites, as they all contribute to this problem-based scenario in a different way. If you use any of these resources as part of your research, you will want to keep track of them, since you will be expected to cite these just as if you would have initiated the research yourself. Another interactive resource within the situation room is the Whiteboard. We are really excited to tell you about this resource, as it is a new feature that we're experimenting with inside the virtual teaching hospital. We see the Whiteboard as both a collaborative learning area and a visual mapping tool. You will notice that this tool is available to all of the students within the course, and anything that you place on the whiteboard can and will be seen by your fellow classmates. But look at this as a benefit. You might use it to clarify your understanding of the problem or discuss potential solutions with others that may be working in the same area. Additionally, by mixing the drawing functionality with text, you have the ability to visually display your thoughts in an effort to organize your research. The floor plan for the unit that you are working on is also available. This may be helpful to see as you're developing your solution. Although it's not included within this screenshot, you will notice blue clouds within the corners of several resources in the room. These allow you to open the document in a separate window. We provided this functionality in case you would like to print the resource or even save it to your computer. The file will open as a PDF document, then just print or save. So let's get to your scenario. You are the lead nurse that works for a mid-sized school system. You are responsible for the care of 3,200 students that are currently in the system. It's a big job, but it's less intimidating once you break it down. 1,750 of those students are enrolled across 4 elementary schools. 675 are in the middle school, and 775 are in the high school. The floor plan for this change project, which I mentioned is in the situation room, is based on the main clinic that is located in the high school. Additionally, the middle school has a small assessment area that you do not have the floor plan for. Fortunately, you're not alone. Currently, you have one health assistant under you. There has been a recent increase in a disease that has affected your state. The Center for Disease Control has recommended that students have a second dose of a vaccine over a 4-year period. In the past, there's been a national shortage of this vaccine. So now that it's available, the CDC is requiring that students are vaccinated 90 days after the 20-day enrollment date. So this would put us in mid-December. It is important that you comply with these orders, as it could affect the student's ability to attend, or funding for the district could be pulled. Recently, the 4 elementary schools received funding to hire 2 additional school nurses, which you are now responsible for. The elementary schools also recruited 2 new principals. The high school also has a new principal, as the previous principal was promoted to the district's assistant superintendent. The middle school's principal is pretty seasoned and someone that you've worked with in the past. There is a lot of concern about exposure among the staff of these schools. The majority of staff don't really understand that the vaccine is not a live virus. Additionally, you aren't staffed or equipped to administer these vaccines. Your team is mostly new, and already the RNs are complaining about being short-staffed. Since your staff aren't used to working with one another, the team isn't really functioning the way it should. In an effort to resolve this, you initiated a change plan to fix it 2 weeks ago. It's difficult to tell if this change will have any kind of lasting effects. Not only are your staff new to you, but generally they're new to the field as well. In fact, half of these nurses have very little vaccination experience. It's also important to note that parents have the option to waive the vaccination. They have been sent waivers, and the district is not penalized for those students who are exempt from getting the vaccination due to a signed waiver by the parents. Your community is mostly spread out. Due to the distance of primary care providers and the residence of your students, it's unlikely that students will be vaccinated outside of school. You were just told that the media is asking to talk with the lead nurse for your district. That's you. This has recently become a bigger issue, as word of the outbreak has made both the national news and daily news in your state. Students, faculty and district administration, families, community volunteers, school RNs, health assistants, state and local health departments, as well as the CDC, are all involved in this issue. I mentioned before that there was previously a vaccine shortage. To give you a timeline for that, it first became an issue about 4 years ago. Additionally, the virus emerged in your state about 3 months ago and has since affected your area of the state specifically. In an effort to comply with the CDC's orders, vaccines will need to be administered at the start of the next academic year. As mentioned, this is a national issue since the vaccine wasn't available until recently. However, since the supply issue has been resolved, the problem has been alleviated at the national level. You will be responsible for several of the compliance procedures associated with the CDC mandate. For example, you will need to submit the state report as well as design and implement the plan. This would include educating the district leaders and communicating progress or issues with neighboring districts. Also, not everyone on staff has completed the education around CDC compliance procedures. Your state requires a yearly renewal of this educational requirement. All public and private school districts must comply with this mandate. Local, state, regional, and national organizations have all been notified. In addition to meeting the mandate by the CDC, you will also need to assess the general fear of a possible epidemic. You will likely get some questions around whether family members should be concerned about contamination. Also, school personnel are concerned about getting the disease from students. The district needs your help. So I better let you get to work. Good luck.